Dr. Rachel Fresco, welcome to Women's Wellness Radio.
Thank you so much. I'm excited to be here today and talk about lots of interesting things on how we can use botanicals to get more healthy.
Yeah, to get more healthy. I like that. Right on. So let's learn a little bit about you. I learned that you're an acupuncturist, which is cool. I am too. And you're a doctor of something. What is your doctorate in?
I studied natural medicine at the University of Natural Medicine, so I got like a doctorate in philosophy of natural medicine.
Oh.
Yeah, so that kind of, helps round out the education a little bit because the program at Five Branches University was like a master's program in
Okay.
Chinese medicine.
Okay.
And so that's where I
Cool. Right on. So did you start out working clinically, like doing acupuncture and herbs, or did you go right into, you've created this herb company? How'd you get started?
Well, actually, when I was in acupuncture school, I was working at Kan Herb Company, which is a Chinese herb company, and I was one of the consultants for the doctors to learn how to use the formulas and things like that. And I was kind of assisting at a couple of different acupuncture clinics and also doing some veterinary acupuncture. And when I got my license from the state of California, I had taken my state boards and I was waiting for my license to come in the mail when I got the phone call from the director of Great Smoky's Diagnostic Labs about having tested the biocidin. So before I knew it, I suddenly had like all these doctors calling me and wanting the formula. So I started practicing like 1 or 2 days a week in a local doctor's office, an MD's office, but I got so busy I ended up not doing a lot of private practice. And I kept up with the veterinary part because that was fun for me. I do horses and dogs and but I kind of moved into more of supplying the doctors with the botanicals.
Okay, so you developed this formula that we're going to talk about, biocidin, while you were a student, basically.
Yeah, just after graduating. I know.
That's really funny.
Kind of just bypassed the whole. I never thought that. I thought I was going to be like a full-time, clinician, but the universe had other plans for me.
Probably added a few years to your life to not be a clinician.
Maybe I don't have the patience for patients.
So this is a lab you mentioned had your formula. Like, how did that come together, that thing?
So one of the doctors that was ordering from us at Kan Herb Company, where I had the biocidin formula available, was dealing with patients with opportunistic infections, and it was the beginning of the AIDS crisis, and these were primarily acupuncturists in San Francisco, and they were trying to work with these diarrheal diseases and opportunistic infections, and back then, of course, there were no AIDS drugs yet. So these patients were, sometimes just dying from something simple like a diarrheal disease because their immune systems couldn't combat it. So the doctors were looking for anything that they could use, that would be, a broad spectrum kind of thing. And so one of those doctors sent it to Great Smoky's and had them test it in their sensitivity to see if it would work. And so then when the owner of the lab saw the result, he was really intrigued, and he called me up, and I'll never forget the conversation because he was so rude, really. He was like, I don't know who you are or what this is, but it kills everything. And I'm like, well, is that good? And he's like, yes, that's very good, and we want to put it on our panel. I'm like, well, okay, whatever. I didn't really know what that meant. Well, what that meant was like 30,000 doctors a month were going to be seeing this is the most highly sensitive agent to combat the yeast and bacteria that they were testing for on the stool test.
Okay, so that's just to interject. So what they were testing against was they would have a stool sample with bacteria and yeast, and they would apply your formula or something?
Right, so they would apply a number of things, just like in a hospital when you have an infection and they test to see which antibiotic is going to work better, right? So maybe they were looking at different antibiotic agents, they're looking at classes of antibiotics or, Flagyl or whatever, and then they're looking at several different candidate substances, which are botanical. So they're looking at things like grapefruit seed extract or plant tannins. And so, they were very interested in putting the biocidin formula on the panel. They didn't want to call it biocidin on the panel because I didn't want to be recommending a particular brand. So they called it a generic name. They called it the gentian formula because gentian was one of the herbs in there. So that's what it was on their panel. And so they ran 200,000 patient samples over a 6-year period where this gentian formula came up as the most sensitive agent. And so that's why so many doctors treating intestinal issues in patients heard about it and started using it and giving feedback. And so we were collecting these before and after results too, and just seeing really, really helpful improvement in these patients. And, before I go too much further, I do want to say that nutritional supplements and botanicals, they're regulated as supplements, right? So they're not drugs. So you can't make medical claims about them. And, they are used as support and as nutritional supplements. So, and we always want people to refer to their clinician or practitioner with any questions that they may have about how to use them for themselves, right? And we at Biobotanical, we help the doctors to learn to use these for their patients, but we don't deal directly in advising anyone who is a patient how to use them.
And these are only sold to practitioners, right?
They're only sold to practitioners in a sense, but because they're available on any number of doctors' websites or our website, because some doctors don't want to carry the things in-house, right? They don't want to, or in some states, they can't sell supplements from their office.
Oh, gosh.
I know. So then they just tell their patient to go to our website. So it's fine. I mean, you can get the things, from any number of places. We've tried very hard to keep them off of Amazon, because what was happening is people can put counterfeit products on Amazon. People put expired people would buy product and it would be like 10 years old, and they'd call us up and, can I still use this? And I'm like, no, don't, it's expired.
No.
So I recommend that, if you're going to use any kind of professional quality supplement, that you get it from your clinician or wherever they tell you to get it. It could be an online pharmacy or any place that is an authorized reseller, but we do not authorize anyone to resell on Amazon. So not the best place to get our products.
Okay. Yeah, I think I have seen you on some online pharmacies too. So I recall that your formula has a lot of herbs in it, like quite a few.
Yeah.
Are a lot of them Chinese? Like, tell us what's in it.
Yeah, so none of them are Chinese in the biocidin, as it turns out.
Oh, okay.
So all of these herbs are kind of like different antimicrobials that are used primarily in Western herbalism and some from more of the Ayurvedic side. You've got, the things like the garlic and berberine containing herbs like gentian and golden seal, and you've got bilberry extract as the first ingredient, and that's very antimicrobial and anti-inflammatory, which is super important for healing the gut lining. So there's like a big combination of things, and as I did the research on biofilms, what I found out is that some of these things like bilberry, for example, or grapeseed extract that's in there, not grapefruit seed extract, grapeseed, like eating grapes. Grapeseed extract and bilberry both can stop the adhesion of biofilms. And if you want, I can define what a biofilm is and why that's important to know. Okay, so biofilms are it's basically like a slimy coating that the bacteria spit out in order to protect themselves from detection of the immune system, and also to stop any antibiotics or any fungals from getting in and breaking them up. So it's like a city with different bacteria and fungus growing together in there with this coating, this extra polymeric substance. And when you have this biofilm, which develops in any chronic infection, so if an infection has been going on in your body longer than 2 weeks, it's very likely that it could have a biofilm component. So that's like sinusitis or recurrent UTI or gut infections or children's ear infections. Lots of different infections can have this biofilm component, and that makes them harder to get to and makes them kind of recurrent. So in the biofilm, they're very slow growing, and then once in a while they spit off a piece of the biofilm and send it to go replicate someplace else, and then it sends out a flood of the bacteria, and you get like an acute symptom, like the UTI situation, where you'll get an acute UTI symptom, and then you'll quell that, but you didn't really kill the biofilm, and so it just lays dormant until you get stressed or your immune system gets weak or whatever, and then they come out again. So as it turns out, and I didn't know this at the time, almost 30 years ago now, but I have since learned that almost every herb in the biocidin attacks biofilms from a different way. They either break up their coating, they stop them from adhering, they stop the quorum sensing, which is how the bacteria first collect together to start to form the biofilm. The plant tannins, particularly like in the berberines and the black walnut, those really obstruct that quorum sensing. So there's just a variety of ways that the botanicals can go in and disrupt these biofilms where Western drugs really can't do that at all. So, the most interesting thing I thought that I saw in the research was that bacteria develop resistance, like antibiotic resistance, because they have this efflux pump. If you can imagine, it's just like a little pump, and when they detect the bacteria detects the antibiotic coming in, it turns on this pump and just spits it out. So the level and concentration of the antibiotic can't really get to be enough to kill the bacteria or kill all of them because of this resistance mechanism. But a lot of the botanicals shut down that resistance mechanism. They shut that pump down. So then they're more effective as antimicrobials, and they help the antibiotics to work better. So in the studies we did on Lyme disease, we saw that by mixing the biocidin in certain cases with certain antibiotics, you could use like way less dose of the antibiotic to get the same kill rate, because the biocidin was helping that relieve that resistance mechanism. So the herbs have a lot to offer in that way. And so if anybody thinks, oh, should I take antibiotics or should I take, a natural antimicrobial? You should think, no, the natural antimicrobials might very well help. If you have to take an antibiotic, it might help them to work better. As long as it's not upsetting your stomach. You could take them at different times of the day, but it is okay in general to use them together.
Okay, this is really interesting. I have a few follow-up questions. So I think that I've heard the question come up, well, is some amount of biofilm natural? Like, don't we have this natural mucus in our,
Yes.
Yeah, you know where I'm going.
Yeah, so we absolutely have beneficial biofilm. So the probiotics and the beneficial microbes in our gut have their happy and good biofilm. But we're talking about the pathogenic bacteria, the things like Klebsiella and C. difficile, or funguses like Candida that develop a biofilm that is not something we want in our gut. And the interesting thing about the herbs is because of their natural selection to favor beneficial bacteria in the soil and on their leaves and self, to support those, because they need those, right, to get nutrients out of the soil. They need the beneficial bacteria just like we do. So the plants have developed this natural selective ability to go after the bad guys and spare the good flora. So that's why, like olive trees that could be 1,000 or more years old, and the oleoropin, the ingredient in the olive tree that's very antifungal and antibacterial, it doesn't kill anything else but the things that you don't want on the tree, the funguses and so forth. So
it's kind of selective.
It is. And so we borrow that selective mechanism by using plant therapies.
Okay. You're giving me so many questions to ask. And I want to ask one about the olive, because some people say, well, like, don't ingest essential oils because they kill everything, or like they're too harsh to use. I mean, these are strong products. I will say that, whether it's yours or other antimicrobial blends. So are they always discriminating? Is there like such a thing as like too much where we're hurting our good flora?
Yeah. Well, so that's the interesting thing. If you look at the biocidin, we did a study with 1,000 patients in the Netherlands, and the doctor at the Four Balance Clinic, Dr. Jeroen Haas, he specializes in a lot of autism, children, and Lyme disease. So those two areas are his big areas of study. And so he put these patients all on a course of biocidin, or some of the other products that we have too, like the Olivirex, and then looked at their microbiome results after a couple of months. And what he saw was that the number and diversity actually increased.
Oh, okay.
Flora. So that being said, however, if you have dysbiosis, or a bad mix of ecology in your gut, likelihood is you do need some kind of probiotic to support the good ones now, because maybe there's not enough of them.
Okay.
And things like olive leaf are a little tougher on the commensal bacteria than the herbs in the biocidin are. So that's why we have this ProFlora as part of our program that supplies the spore-forming strains, as
Okay.
well as things that are anti-inflammatory, like the super high potency quercetin and the aloe and marshmallow. So, you know, even though the biocidin itself isn't necessarily going to hurt your good flora, that's not to say that you shouldn't use flora during your protocol. And with
Okay.
SIBO, for example, I don't know, you know, you probably are familiar with SIBO. So people with SIBO can't tolerate regular probiotics because it makes them worse. But with the spore-forming probiotics, it's fine. So that's why we chose those for that product rather than your regular acidophilus and bifidus products. The other advantage too of the spore formers is that they don't have to be refrigerated. You don't have to worry about, you know, traveling with those. They're super easy to use.
Yeah, we generally recommend the Megaspore brand. We're good friends
Right.
with
So
them.
Megaspore, you know, licensed their
Similar.
strains to us.
Oh, nice. So
Yeah.
and
So
then you
that's,
added some things. It sounds.
yeah, and we added some things.
Okay.
Because we had other things we wanted to do. Like when we found out that 100 milligrams of quercetin had been clinically tested to stop leaky gut and shut down the tight junctions in the gut, we were like, ooh, what a great thing. Also, the fact that so many people have histamine and mast cell issues, right, with their gut disorders. So this quercetin we found is a special one from South America that's grown in a sustainable way and is 170 times more bioavailable than standard quercetin that most companies use. So that's where I think our company differs is we're always looking for what's the cutting edge best thing that's going to give us the biggest bang for our buck. And yes, that quercetin costs a little bit more than another quercetin, but you only have to take one of these to get your whole dose of gut healing quercetin a day with all those probiotics too. So, you know, we try to be efficient and so people don't have to take so many different things.
Yeah, I'm the same. I'm like, there's a lot out there. I'm just testing to find the best things. I don't develop them like you do, but I test them on myself and I read up because it's like we only have so much money for supplements, so we might as well have them be strong. Okay, I have one more question, then we can move on. So you said it disrupts the quorum sensing. Now I know that quorum sensing can also be a good thing, like with Megaspore talks about that can go in and do quorum sensing and bring up the good population.
Right. So I think it would be the same. Yeah, I think it's like the biofilms. It's like if it's a good bacteria, it's not going to inhibit the quorum sensing.
Okay.
Like it does in like a bad bacteria.
Okay, so there's good bacteria and it has its biofilm, and then there's bad bacteria, it has its biofilm or infection or whatever.
Right.
Are they all tangled up together?
I have no idea how that actually looks in reality. It's like, and I've seen endoscopic pictures of the inside of somebody's gut that has like C. difficile or candida, and it's just one big mass of like white goop.
Oh, wow. So maybe it's just quantity-wise more than the good ones, or maybe there's none good ones.
Like the areas of the intestine that are not inflamed and that have more of a normal gut lining.
That's true.
The good ones, and then the places where it's taken hold, and those like the candida hyphae can punch through the gut wall and
kind of
cause a lot of trouble. So then you're going to probably get like adhering right there of the bad ones.
That's a good point. It's a long tract, so probably some sections are infected, whether it's your like small intestine or some section of your large intestine or whatever. So, okay, that's a good point. I guess I'm a visual person. I just want to like.
That's a good question. I'd love to ask like a gastroenterologist to about that.
Yeah, I know one, so I'll have to ask him next time I see him. Okay, so we've talked a little bit about this biocidin product. It has a lot of different antimicrobial herbs in it. And then this olive rex I haven't used yet, but I have used olive leaf for myself for like viruses, and it's like one of my favorites. But
I love it for that.
Yeah, I don't know much about how it works. So what do you guys use it for?
Well, Upjohn actually did like 12 years of research to make a drug out of olive leaf extract. And what they found was they somehow couldn't make a drug out of it. But because they did all that research, people who want to use olive leaf can go back and look at the studies and the things that were published. It is very antiviral. It's also antifungal and antibacterial. And so the thing that I found out when I was researching olive leaf is there's so many different grades of it. I mean, you can go to a place like San Francisco Herb Company, and you can buy a pound of olive leaf for $5. Or you can get the olive leaf from where we do, where it's like some pharmaceutical grade product from Europe that's organically grown, and it comes with all these certificates, and you know, it's all been massively tested, and it's like $200 a pound. You know, so everything
of the leaf itself?
the extract. So we get
Oh,
the
okay.
extract.
Gotcha.
We
Okay.
get it already kind of purified, like more pharmaceutical type of product.
Okay.
And so like with the olive irex, you could take 2 capsules, and that's a pretty hefty dose. Whereas, you know, when I was taking, before I made the olive irex, I was using another company, and I had to take like 8 of theirs to get
Oh.
the same effect as like 2 of this, because they were only using like 11%
Oh,
olive
I'm
leaf.
actually out of it, so I'm gonna have to get yours and check.
Yeah, ours is 22 to 24%
Okay.
polyruben, so it's quite a bit stronger. And then we have like 75% of the capsule is the olive leaf, and then the rest is a blend of those other little support herbs. And they're almost homeopathic levels of those when you think about it, because there's only like 10 milligrams of each. So, for example, there's not enough St. John's wort in there to bother somebody who's on an SSRI drug. There's no contraindication. But some of those herbs in there, like the cordyceps, you know, just a little bit can be a nice immune modulator. And there's things in there like the dandelion and the bladderwrack that help guide the herbs to the detoxification pathways of the kidneys or liver. So that's the logic about having a little bit of those other herbs in there, is just to help guide it to the channels, guide it to the organs. We've had really good results using that formula for a variety of things, and especially in a situation where you've got a difficult case and you just want to throw the kitchen sink of antimicrobials at it at that point. And so we combine the biocidin and the olive irex in any difficult situation. And we've had people that have like C. difficile, for example, and these patients may have already failed multiple courses of drug therapies, and they're kind of, what am I going to do? You know, I've tried all the heavy hitters and I still have C. difficile, and that can be dangerous. It can be life-threatening. And so that's when, you know, we just really want to use all the different tools that we have. But we were talking about things that can be harsh, like essential oils, and the amount of essential oils we have in the biocidin is very, very small. So it's never enough to cause a problem. Like, you can buy those whole oregano oil capsules, right? And they're very good antimicrobials, but they can be really harsh on the stomach. You can start burping up oregano oil or get burning pain in your stomach. But that's why our essential oil amounts are very, very small, almost just like a little bit of boost, but without ever being so much that you would get a bad reaction to them, or there would be enough to cause toxicity, for example. And that's a question people have. They're like, oh, I don't know if you can take this internally. But yeah, it's almost like a homeopathic level at that point.
Yeah, and what I'm learning as I get into the essential oils field, it's very controversial. Should we use it internally or not? I think just with discretion. You don't need to drink vanilla oil or whatever, but
yeah, you don't really want to use a lot of essential oils by themselves and internally. And so that's why this formula has been blended in such a way that all of the ingredients are balanced. There's not enough of any one thing to throw you off in a particular direction.
Okay. Well, speaking of that, and this might lead us into the next product you offer. When I have taken biocidin in the past, it's a lot of rumbly stomach, you know, a lot of activity going on in there.
Like the die-off and stuff.
Yeah, or maybe a little loose stool. Like, I'm pretty sensitive. I have a fast metabolism. So how would you recommend people who respond like that?
Yeah, so we always, first of all, you have to think about the fact that this biocidin is so concentrated compared to like a normal tincture. Like, people think of herb extracts or tinctures like at the health food store, right? And you take like a dropper full, right, at a time. But these are like 1 drop is a dose. And so for somebody sensitive, you could put 1 drop in a big thing of water, like a glass of water, and you could take 1 sip of that water and see how you sit with that.
Okay. You know, I like that. I think that was it. Go ahead.
Yeah. Yeah, and then we have the GI detox, which is a special type of clay called pyrophyllite. And the pyrophyllite is water soluble, and it doesn't cause like the problems that things like bentonite can with congestion. So we have the GI detox, and so after like an hour after taking the biocidin, when you want to mop up those toxins and biofilm components that you've broken down, then the GI detox helps to stop you from having those kinds of like die-off or Herxheimer reactions.
Okay.
And so our protocol that we always recommend as like a baseline of things is like use the biocidin, use the GI detox an hour later, and then take that probiotic, Proflora 4R, at night. Those three things would be like, I'd say, minimal for anybody who's had any long-standing condition, right? I mean,
Okay.
you know, so if
I
you're
like that.
just, yeah,
Yeah.
if you're a person who thinks you've had Candida or SIBO or something for years, right? You want to start super slowly, work with your practitioner, work on the diet and everything, and then gradually increase per your tolerance. So, you know, one person could go up on the dose of biocidin to 5 drops 3 times a day, which is sort of the average dose, and they'd be fine. Another person might take 2 months to do that. You know, they might have to go much slower. And the only time I would say that, you know, you could go up faster on these things is like if you have an acute situation, like you said, like you know you're battling a cold or something like that, and you
Okay.
want to just, I'm going to take 6 of these olive leaf a day, and I'm going to take, you know, 3 squirts of biocidin for a day or two. And that happened to me twice in the last 10 days. Everybody around here has been getting a flu that's been going around. A lot of people are out, and I started to catch it a couple of times, and I got a little bit of a fever and super tired. And so luckily I was in a position where I could go home and rest and eat a super clean, you know, detoxifying diet, and take a lot of these herbs and go to bed basically. And so I was able to not get the full-blown cold that was going around. And then like 5 days later, it started to try to come back again. Did the same thing. Okay, one more down day, take my herbs, you know, and then that includes things like zinc and C and, you know, other
Yeah.
things. And then and I was fine. So I managed to
Yeah, I have
avoid it.
used, I still, one thing about your formula, it lasts forever. So I have used it a couple of times. Like if I'm out of something I'm more familiar with, I'm like, oh, I know this will get a lot of things. So I like
Yeah.
your advice on dosing too. I think where I learned the protocol on biocidin, it was sort of like, well, this is the ideal dose, but you can, you know, start slower, but keep trying to work up to it. But yeah, I like the theory that maybe less is more in some people.
I think
And
so. And you're not a big person, you know, you're
no,
fine boned. So somebody who is on the lower end of the scale weight wise, you know, 10 drops a day might be fine. I mean,
yeah.
normally we're giving like 1 drop per 10 pounds of body weight to like children or pets. So,
Oh, okay.
you know,
Okay.
so if you're closer to 100 pounds, then sure, 10
You don't
drops a
need as
day.
much. That's a good point too. That's a good point too, especially with something that's like so powerful
Right.
as this. Yeah, and I like to,
Yeah.
I've gotten way into binders. I just wrote an article about it. Yeah, speaking more on the binders, I've been looking up a lot about the different types of clay. I forget what you said yours is, but I think they also call it sacred clay. Is that
Yes,
right?
the sacred clay or pyrophyllite clay. So it has some interesting characteristics that are a little different than other clays. And we've just found that one to be very effective and well tolerated. And then we added in a little bit of activated charcoal
I
to
like
help
that.
with the mop up. And do you know who Jill Carnahan is, Dr.
I
Carnahan?
do. Uh-huh.
So Jill told me that she's been using that as a mop-up agent for people with mycotoxins and mold illness. And
Yeah.
she saw in the before and after lab results that this could be used instead of some of the other very expensive drug therapies that she was having to use, and with less side effects. So she was a
Yeah.
big fan of it for mycotoxin mop-up. And I mean,
That's what I use it for.
I've seen
Yeah.
it work for others. Like this was a funny story. I was at a conference, and this man comes to me, up to me at the booth, and he happens to be the AV guy. So he's not a practitioner, and he's the AV guy. But he goes, you know, I came back from India with this parasite, and do you think your stuff could help? I'm like, well, yeah, doctors use it, you know, for people who have tested positive for parasites. And I said, you know, let me just give you like a drop and see how you react to it. So I was just going to give him 1 drop. So I reach across the table with the dropper, and somebody saw me doing that and thought they were going to help me out, snatched the dropper out of my hand and squirted it in his mouth. And I didn't want to freak him out by saying, "Oh my God." So I just stood there and I'm like, "So, how are you feeling?" He's like, "Well, I feel kind of, I think I need to sit down." Because he was a real thin, real small, real sickly looking guy with massive amounts of parasites. Okay.
Oh,
So
wow.
you probably would not give somebody like that a whole dropper full of biocidin. So I sat him down and I said, "Well, I want you to take 2 of these GI detox right now." And I gave him some water and I had him take the GI detox. And within like 5 minutes, he's like, "Wow, I feel fine now." And I'm like, "Yeah."
Mm,
So like if you need to mop up something fast, let's say you ate or drank bad food or drink, or, you just, something wasn't sitting right with you, or it's happened to me before being at hotels where it's moldy in the hotel. And all of a sudden I can't think straight and I'm kind of stumbling around because I'm mold sensitive. If I remember, because I'm stumbling around at that point from the mold, but if I remember to take a couple of the GI detox, it
mm.
does pretty quickly make an effect. So it's kind of a nice one to keep in the medicine cabinet and for traveling for that reason. You
Yeah,
know,
I would totally agree. I would totally agree. And I have a mold group on Facebook, and a lot of them, people use different binders. Like a lot of people are into chlorella, and I just
mhm.
recently started on that. So there's, as I study, there's like at least 12 different binders.
I
They're
think
all a
it's
little
good
different.
to use some of them, rotate them around and see what works for you.
I
And
agree.
yeah, so
Yeah.
that's what I do. And people are always asking about, like you were talking about, well, like when you're traveling, what can I do to protect myself from getting sick? Everybody's coughing around me, or it's, my kids are going to school and bringing home things from school. And so we made a throat spray version of the biocidin. And so
Oh.
it's diluted like 40%. So it's already pretty dilute. So you can spray 2 or 3 sprays in the back of your throat, and you get all of the antimicrobial benefit. And then if you do that and say pop a couple of those olive Virex, that's
Mm.
my kind of go-to for when I get on the plane, for example. Anytime that I want some extra protection. And we actually did a study on that with the University of Louisiana. They have a situation where one of the heads of their departments of research happens to be a coach for Olympic coaches. And he
Mm.
says that they have all of these elite athletes that really work out hard, like professional NFL football players or Olympic people or marathon runners. And their immune system in their upper respiratory tract, their SIGA, will test as suppressed post-exercise.
Mm.
So that means that they're susceptible to getting upper respiratory infections because their immune system is basically worn out.
From the
Um,
exercise, high
from the
level of
overexertion.
exercise.
Right.
Yeah,
So he
interesting.
wanted to do a study where they would give the athletes the biocidin in the throat spray format, like 30 or 60 minutes post-exercise, and then measure this SIGA again in the saliva. So
Oh.
they took, like, I think 20 or 25 people and put them through the rigors of a extensive exercise, measured the SIGA before and after the exercise, and then saw it drop, and then gave the throat spray. And just one dose post-exercise raised their SIGA by like 66%.
Wow.
That's a big
Wow.
increase in immune protection. So,
Do you want
you
to
know,
explain what SIGA is for listeners?
so secretory IgA is like a marker of the immune system's response. And that SIGA goes through your whole gut too. So it's not just in your mouth and your saliva, but it's in your entire intestinal tract. And so the doctor that I was mentioning in the Netherlands, Dr. Haas, he also measured the SIGA in those patients that he followed, those 1,000 patients. And what he saw that was interesting was some patients would have an overactive SIGA, like an autoimmune kind of thing, right, where their immune system is too active. And some people will have one that's suppressed. But what seemed to happen by using the herbs that we had was that it seemed to normalize. Like, it seemed to have an adaptogenic or normalizing effect on
Mm.
the SIGA.
So it's
So
stimulating the immune system in some
yeah,
way.
or modulating it.
Okay,
So it's
modulating.
stimulating it if it's too low, and it's balancing it if it's too high.
Okay. Yeah, we never seen a high one. We always see them low one.
Yeah, so he had some high ones. So
Okay.
so Dr. Ballard at the University of Louisiana is about to publish this research in a peer-reviewed journal. So we will have a, you know,
Great.
published that trial.
Congratulations.
Yeah. So that was a good one. And but it's interesting because you know, you think of biocidin primarily as antimicrobial, but there's a lot of immune modulation that's helping the system too.
Okay. Yeah, and I mentioned that we see pretty much all our clients have low secretory IgA. And just so you know, this is with a stool test we run with our private clients. So it is making you, not only is these athletes having it, you know, affected, but just I think from the stress of life, it's low often. And then you're more likely to autoimmune disease and, you know, leaky gut. Just a lot of things could go
Right.
wrong if that barrier isn't strong. So pretty interesting that you could use this little spray and bring
Yeah, for
that
the
up.
gut, I would say go ahead and use the liquid biocidin because that's going to get down, you know, and it's probably going to be more effective in the gut. The spray is nice for like the upper respiratory, like
Okay,
sore
gotcha.
throat or, you know, preventing upper respiratory things. And you can also use the liquid biocidin because it doesn't have alcohol, and you can mix that with saline nasal spray or a neti pot, and you can wash your sinuses with it. And this is super effective for people who have like chronic sinus issues or
I
even
bet
acute.
it could be good for, do you think it could be for mycotoxins too?
Yeah, so we've measured that with the Marcons
Oh, please tell me.
before and after. Yes, that has been very effective. So we actually have a little kit that the doctors can get. And it's got the buffered saline packets, and it's got a little nasal spray bottle so that you can at home mix up your own little solution of saline, pour it in the nasal spray bottle, and put in the drops of biocidin, like 10 or 12 drops of biocidin in an ounce of the saline. And you can use that a couple times, 2 or 3 times a day, for say 6 weeks if you've had
So
a
that's
chronic
just a
problem.
spray. It's not like a really like high volume rinse.
No, so for the high volume rinse, you just have to use more biocidin because if you figure 10 to 12 drops in an ounce of water, I have one of those high volume rinses that you squeeze,
Uh-huh.
shoots the water up your nose and out the other side. Have you
Yeah.
seen those?
Yeah, I
I like.
use that.
Okay, I like that one too. So if I was going to use that one, maybe I would only fill up the bottle halfway because I wouldn't want to have to put in, you know, so much biocide.
Yeah.
But I would put in maybe a couple droppers full, shake it, and then use that. Or another thing I've done is I've rinsed first with the saline with the big squeezer to get everything cleaned out, and then at the last bit, put in the biocide and leave that at the end so that that stays in there.
Okay. Yeah, I've also done it the opposite way too, where I sort of use the agent to get everything moving and then I clear it with just the saline. Interesting.
Yeah.
So you saw Marcons go away in a before and after test?
Yeah, in fact, an acupuncturist, Dr. Holly Guzman, just called me 2 weeks ago to say that she had a patient that cleared with Marcon.
Okay.
We've seen MRSA too.
So yeah, I had a before and after Marcons and all I've used is herbals and it wasn't gone, but it was different, a different score, but it wasn't gone. So
Mhm.
the Marcons wasn't gone, the mycotoxins weren't gone either. So it's a bit of a bummer. So I just thought, okay, well, I just have to change up my strategy.
So one thing to think about in some of these people is whether you want to use the liposomal version of the biocidin, because the liposomal version is now in this nano size that can go directly into the bloodstream and intracellularly. So some of these pathogens, you want to bypass the gut and you want to get directly into the bloodstream. So I would say for those people with those Marcons, I would use the liposomal biocide, and you can put the liposomal in the nasal rinse as well. I mean,
I didn't know you
haven't
had
found.
that.
Yeah, I haven't found. We got that up a couple of years ago. We did Lyme research with that
Oh,
formula, and because it penetrates intracellularly, and you've got a lot of intracellular pathogens with Lyme, and neurological compartment issues where the liposomes being a lipid are going to have more of an affinity for the nervous system, which is more of a fat-based system, right?
okay.
So basically just think about it this way. If you're gonna treat the throat, use the spray. If you're gonna treat the gut, use the drops. And if you're gonna work with anywhere else systemically and you want it to bypass the gut, then you can use the liposomal.
Okay, so you can ingest it or soak it in your mouth, put it in your nose. Do you rub
Right.
it on your skin too?
I do. So we've had people
Okay.
use it on their skin testing before and after who've had skin infections. And um, the dental study we did was really interesting. The dentist scraped the plaque in a patient's mouth. She happened to be a naturopathic doctor, and looked at it under the phase contrast microscope. And she had all this bleeding gums and puffy gums. And so he scrapes her plaque, looks at it under the microscope, and it's just teeming with spirochetes.
Ugh.
Not Lyme spirochetes, but I didn't know that spirochetes were a common pathogen in the mouth. So these spirochetes, these bacterial rods, biofilm, all of it. And you mean I have a picture of it in a presentation I could show you. And after swishing with that liposomal biocidin for 6 weeks, and then she went back in and he scraped the same area again and put it under the microscope again, and it was pretty much gone. I mean, it was night and day looking. And so he got very excited and called us up, and he's like, oh, I want to study this more. So we sent him a few cases of the liposomal biocidin and said, study it all you want. So he tried like 12 patients with the same exact procedure. They'd come in, they'd scrape, they'd take a picture of it, they'd send them home, have them swish, and then take a picture again after 6 or 8 weeks. And every single patient, the results were the same. It was super, super good. So we got so excited about that we decided to put the biocidin in a toothpaste, and so that you could brush every day with it for helping clear the biofilms and clear the bacteria in the mouth. And then you could rinse with the liposomal as like an extra treatment if you had a specific problem. So that's been very successful. People love that. I think that this dentalcidin, we're calling it, dentalcidin, I think is going to become a mainstream dental product. When I show this to the perio doctors, they're blown away. They're like, we've never seen anything like this. So then the dentist did a study where he actually went into a root canal where the cavitation is, right? Cleaned it out. They ozonate the area. Before they ozonated, they took a sample of the DNA of the bone and sent it into DNA Connections lab. And it came back with like 35 different pathogens, including amoebas, including HPV virus, including nasty, gross bacteria. And, you know, this is in a root canal cavitation. So no wonder Hal Huggins said that these root canals were causing so much, trouble for people. And so they had him do the same thing. So he would clean the area, he would flush it with ozone, flush it with the liposomal biocidin, and then sew it up, and then send them home with a liposomal biocidin and keep applying it twice a day for 6 to 8 weeks. And then have them come back in, open up the wound site again, go back into the bone, take the DNA sample again, and send it to the lab. And so he did this so far on, I think, 9 patients. And every single patient went from having like 35 bugs in there to like 4, sort of normal ones.
Wow.
So we really are hoping to find a university that wants to do a larger study on this dental issue, because I think that this could be a key that no one else has looked at. It's like these antibiofilm and antimicrobial botanicals could have a real impact on people's oral health. And now, like the American Heart Association has been publishing information that shows that dental bacteria are found in cardiac tissue. So
yeah.
causing problems, biofilms on the stents, right? And so I think that there's a larger health implication to leaky mouth, I'm calling it, right? Because when you go in to get your teeth cleaned and that bleeding is happening, all of that bacteria and biofilm and stuff could go into your bloodstream, and it could set up shop anywhere, just like leaky gut bacteria and biofilms set up shop and cause inflammation. The oral cavity is exactly the same scenario. And so it's really important to treat the pathogens in the mouth.
Yeah, it's full of bacteria, those cavitations, like you mentioned. Most people don't know about that those, even if you've had, like wisdom teeth out, you could have infection in there. And you don't feel it in a traditional sense. No. It's just weakening your health. I have one friend who does breast cancer, and she's like, you have to check your mouth. That's part of the protocol. I have to see a biological dentist. So yeah, I think it's important and overlooked. We talk about it in kind of stubborn infertility cases even. Right. So yeah, it's great. I want to check out the toothpaste.
It tastes good too. It tastes good. It works really well. And I was using it for when I first made my first demo, batch, and I decided to just keep using it for a month, before anybody else had tried it. and I was like, wow, my teeth feel really clean and everything's good. And then I ran out and I went back to using the little tooth powder that I had been using, which was like a sea salt baking soda kind of tooth powder, which is, you know, a healthy. I mean, I would never use anything like Crest or Colgate. I mean, never put fluoride in my mouth and all that other crap that they have in there. But so I went back to using my regular toothpaste or tooth powder, and within like 3 days, I'm like, my teeth don't feel as clean. You know, like I noticed with the Dental Side and toothpaste, you can go all day into night and your teeth still feel clean.
Oh, wow.
So
Cool.
you'll have to get a bottle. I'll send you one and
Oh, yeah, I would love to try it. I would love to try
so we're
it.
giving a free one of those now. So I got so fond of that product that I decided that anybody who is committed to doing like the 2-month protocol of our whole range, so you get like enough Biocide and Olive RX, GI Detox, the Flora, and also the Chinese herb formula, the Biotonic, you get that whole kit for a 2-month supply. And, you know, it's a pretty big investment for people. I think it's around $400 and something, you know, for the patient. So that's like $200 a month to take all of those products. So I thought, you know what, if somebody's invested enough in their health and they're going to do this seriously and do this protocol, let's give them a toothpaste so that they can do their mouth too. So we started putting a toothpaste in the box last month for everybody who's ordering that. And I think we're just going to keep doing that. I'm just going to
Nice. Yeah,
make that part of the kit. And it's a nice perk. And also I think it's necessary, right? You don't want those bacteria from your mouth reseeding your gut, you know?
Yeah, I have a question. So I have one little amalgam filling that I'm concerned about. I mean, I have a lot going on in my health, so maybe it's not like the top, but I'm concerned about it. And my dentist, of course, like conventional, she's like, oh, it's small, like just leave it there. But I wonder about it. Now I'm wondering if the toothpaste or the liposomal could like maybe help counteract if you have a little metals coming out or anything.
No, I don't think so. I think you should get that out and put it in something else. You know, I go to a biological dentist and, you know, they test for compatibility, you know, of different composite materials or whatever. And so that's what I did. I mean, like 15 years ago or more, I took out all of my amalgams and replaced them with composites.
Could you feel any difference, would you say?
Yeah, you know, I don't know. You said you have issues with mold.
Yeah.
So I had a really long period of time where I was in a house that had a severe mold problem. And so I had huge mold exposure. And so my immune system just went haywire. And I was very ill. I had every symptom that like the worst patients had, like multiple chemical sensitivities, autoimmune disease, coughing until I vomited in the morning with asthma.
Oh gosh.
I was, you know, very, very sick. My autoimmune titer was like 5,000, which is like 0. So I had to work to get myself out. And the worst symptom that I had, definitely the fatigue was bad, but the fibromyalgia. I couldn't carry my purse. I couldn't walk on the beach for half an hour without excruciating pain, being on ice and Advil. I couldn't exercise at all. I was really a sick little puppy there. And I had previously been really healthy. And, you know, before I was an acupuncturist, I was a horse trainer and riding instructor. So I was like hefting bales of hay and, you know, I was used to being really strong. And after that mold exposure, my health suffered so severely. So I got myself out of the moldy environment and I started detoxing from the mold. And I learned a lot along the way about that. And so if I had had the liposomal Biocidin, then that would have been a big help. And the GI Detox, that would have been a huge help. I use the infrared sauna a lot to help detox the things. And so at that time, you know, the dentist saw me suffering so much with all this other stuff. He goes, well, your mercury is not helping your situation here.
That's kind of how I feel. I think, yes, where before I could have handled it. I think now it's harder to handle, so to speak. Yeah.
So I had to, you know, for me, like I am a big proponent of taking the straws off the camel's back, you know. Don't wear scented chemical products. Don't clean your house with these things. Certainly never consider spraying Febreze or having a Glade plug-in anywhere.
Don't get me started on Febreze. I hate it so much.
And so other people think we're nuts, right? But when you've been injured in the way that we have with mold, your immune system becomes extremely sensitive. So we're like the canary in the coal mine. This stuff is hurting everybody else too, but we feel it, you know, right away. And
Yeah.
so, so for me to have, I have to have tools constantly to help keep me detoxified. I have to eat a very clean diet, an anti-inflammatory type diet, and then I'm good. And now I'm
Okay,
working
that's good
out
to
hard
hear.
and I'm doing yoga. I remember I couldn't hold like a triangle pose to the count of 6 without being in
Yeah.
excruciating pain. And now I can like go to a yoga teacher training and do yoga all day and I'm
Oh, that's
fine.
great. I remember when I was first really sick and I kind of emailed my studio owner and I was like, I have to cancel. Like, I can't, I'm really sick. And she's like, you just need more yoga, which is
Yeah.
really sweet. But it's like,
Nope.
so yeah, sometimes just getting out of bed is really hard. And you
Yeah,
just,
I mean, I was just laying on ice packs, after doing like the smallest thing.
yeah,
I was in so much pain. And so I feel for people who have fibromyalgia now. And if you're listening to this and you're suffering in that way, think about detoxing. Think about the far infrared sauna. Think about cleaning up your gut. Think about getting anything toxic in your environment and in your body out.
yeah,
And
I totally agree. I think it's often a toxicity issue with fibromyalgia, chronic fatigue. I wanted to mention, since we brought up them removing the fillings, you said, you got to have a biological dentist. And then my friend recommended, before I would consider it, there's a test, a Cyrex Labs test that will see if your like blood-brain barrier is intact enough to have, mercury go flying around. So yeah,
right.
apparently you're not supposed to have them out if you're one of those people. So
That's a good point. Good
yeah.
point. I love Cyrex. I love their test. And they're one of the labs, one of the few, I think, that can legitimately test for the LPS. LPS, the lipopolysaccharide, is the component of biofilms, the outer shell of the gram-negative bacteria. And the biofilm has this LPS endotoxin. And so if you test with that Cyrex array and you have this LPS in your bloodstream, you have a smoking gun for leaky mouth or leaky gut. Something's leaking these
Mm,
endotoxins and biofilms into your bloodstream. And that's a really, really good test to do. I know it's a little bit expensive test, but if you had long-term health issues, go to find a functional medicine person.
that might be the same test I'm talking about. I'm not sure what they're called, but it might be the same. Leaky gut, leaky brain. It's just a marker of leakiness.
Leaky marker.
Yeah.
Yeah, so that's a good one. You should have Jama from Cyrex on sometime on this podcast. She's brilliant.
Oh,
She
okay. No,
talks
I don't
about what
know
they
her.
do. Yes, I'll
Okay.
introduce you. I like Jama a lot. She's
Okay.
a really good scientist. So
Yeah, it's good to know that we have these options. I mean, I see, I just talked to a potential client today, and I could tell she was like, oh, well, maybe I'll just keep doing what I'm doing. But I think there's reached a point where it's like you can't just keep like trying to fix it with diet. So you need
no,
some
you can't.
testing.
I mean, diet is a cornerstone and a key component to getting better. Absolutely. But it's just like people like, oh, if I just take probiotics, I'll fix my gut. No. If you've got a big old, biofilm of bacteria and yeast in there, you have to eliminate them.
You do.
Just
Yeah.
taking probiotics isn't going to do it.
Yeah, and it's we've done an episode on this. It's not like, you talked about a 2-month program that costs $400. It's still probably very reasonable. It's like, and you got to take your stuff. I'm sure you can't be screwing around and going out drinking all night or whatever.
But you have to make a commitment to focusing on your health for a couple of months, having super clean diet. I recommend a gluten-free, dairy-free, low carb-ish, lots of vegetables, and adequate protein. I'm not one that necessarily thinks that these super high protein and super high fat diets are a good idea, because high fat can cause the release of endotoxins. So people who are
Mm,
drinking gallons of like the MCT oil, like I had a friend and she's trying to lose a bunch of weight, so she's doing like an extreme end of like, bulletproof diet or Atkins type diet, where you're just having nothing but meat and a teeny amount, like, what is it, less than 30 grams of carbs a day or something
and a
like that.
keto, uh-huh.
You're at total keto, and then you're drinking massive quantities of this MCT oil, and she got sicker and sicker and sicker. And I think she has SIBO. Her symptoms are like SIBO.
Oh,
So if you've already got intestinal bacteria, and then you do that, you're just going to flush all those toxins into your bloodstream.
yeah,
So I think it's
yeah.
better for people to have a little bit more of a balanced diet, like lots of leafy greens. Don't worry about the carrots that have 10 grams of carbs for 2 carrots.
Yeah, there's all these phytonutrients in there.
Yeah.
I was just talking to a colleague about this the other day because I was eating paleo, for a long time, sort of, more or less. And then I started learning about alkalizing, really to like oxygenate my blood and like get more energy. And I started adding in not even a ton, but just like some green juice and like more salad. And it really makes a difference for me. So I don't advocate. I know I'm going to get some complaint. I'm doing great on the keto diet. I mean, I think
that's the thing. It's
it could
individual.
happen.
Everybody,
Yeah.
There's no one size fit all for diet. I'm hypoglycemic. I tried doing that intermittent fasting, and I had doctor friends tell me, Rachel, if you just do the intermittent fasting, it'll cure your hypoglycemia. So I battled it. I tried it. I did it for like 3 weeks straight. Raging headaches, can't think, can't move every day. If I don't eat by 10 in the morning, and I'm physically active in the morning, I do yoga, I do Pilates, I work out on my little, Nordic track thing, or I walk the dogs on the beach or whatever, I have to eat at least a protein drink or something. I can't just not have anything because my blood sugar won't allow it. But I have other friends who are like, oh yeah, I just eat once a day, and I look at me and I'm like, I hate you.
It's true. I have a friend who only eats twice a day, and she's great. She's healthy, but I'm like you. I wonder too. I mean, it sounds like we have some similar health history. It's so hard on your adrenals dealing with like chronic infection and stuff. And I just think to also manage like, hey, Rachel didn't eat a meal. What the heck are we going to do? Like, that's too much of a crisis for your body.
Yeah. I think for somebody who has blood sugar issues, the key is keeping your blood sugar regular and don't let it get spiking. Don't let it. So that's why you don't have a bunch of sugar or a bunch of carbs at once. You have, more like a zone works for me, where you have like a small amount of protein, a small amount of a healthy carbohydrate. For me, that might be some quinoa or a sweet potato or yam, a little bit of brown rice or something. And that works well. I mean, yeah, I like my gluten-free toast once in a while. I'm sure it's kind of junk food, but at least it's, okay. And then I have like a bunch of greens of some kind, whether it's steamed greens or if it's salad or if I have soup with a lot of vegetables in it. And so for me, that works. I met a girl, I was at a yoga retreat in Peru, and this woman was stunning. I mean, stunning. And she's like a surgeon, and she's brilliant. And I'm watching what she eats, and she is eating nothing but fruit. She's got this giant plate loaded this high with fruit, and she's just chowing down all this fruit. And I'm watching her and thinking I would go into glycemic shock if I ate that for breakfast. And we're hiking up like Montana, Machu Picchu, like 3,000 meters above the Machu Picchu ruins, on the Inca Trail. And I'm like so happy that I have like some spirulina and some like protein bars, and she's like up there on a papaya. And
but that's like a fruitarian, right? That's a thing.
And she could do it. And it completely works for her. So I think diet is individual. I think you should never get fixed in what somebody else's idea is, and listen to your own body.
Yeah. And I mean,
not listen to your body telling you to go eat a candy bar, but I mean, listen to your body's, healthy response.
Yeah. I love it. I think we have a lot in common, Rachel. It was really nice to meet you. So let's see here. I want to talk about your resources. You said your main site is biocidin.com. We'll link to that and in the show notes and the blog notes. You've got some products that you mentioned. Again, like you can work with Anne and I to actually know what you're trying to kill, which I think helps a lot too. It might help you stay on a path rather than just being like, well, I guess I should do this because they said so. I think seeing in black and white your bacteria imbalance and all that
helps.
To know
when you're better too. Like if you don't know where your baseline is, how do you know when you're done treating it?
No, it's true.
Because a lot of times people don't have symptoms.
Yeah, there's some things I need to retest.
If you have a real obvious symptom, then or you just absolutely can't afford to get any test, and it's like, well, I just want to do a cleanse. Okay, you can do things that way, but I recommend getting the testing, and I recommend being followed by a practitioner, and if you've had a really long-term situation, you may be 6 months or a year, right?
At least,
but I've seen in that first 2 months, if you're really dedicated and you do everything right and you take products like this to clean up your gut and rebalance your immune system, that you will feel more energy, you will stop having like 70% of your symptoms, or at least they'll be greatly, greatly reduced. And that's enough motivation in those first 6 weeks to 2 months. Like, wow, I am on the road to recovery. And that'll inspire you to continue. And when you walk past that pastry window at the Starbucks, and you just don't even want any of that junk. You just like, ew. Your body starts to clean up and you don't want sugar. You don't want caffeine. It's funny, I don't even hardly use, like I kind of switched to matcha. I used to drink like a little bit of coffee, and now I switched to matcha, and now I hardly ever do that. And I have plenty of energy now because my adrenals have come back,
Yeah, it puts you on a roller coaster. I've been wanting to share a picture when I go to Starbucks, because I still like to go somewhere to work. I work from home. Sometimes I got to get out of here. So I go, Starbucks is right nearby. I'll get a greens with lemon juice. They sell that. And now I found out they sell roasted almonds if I get hungry. Like,
yeah.
But you can get stuff there just if you want to be out and about. And I'm not saying I'll never have a chai again, but when I have it now. Oh yeah, I love chai. But
I get the rooibos chai.
Yeah, you can get it in different ways. Yeah, I think it's just a process. Like last time I had one, I was, I could feel the caffeine and sugar so strongly because I am doing so much less. So it's, you wean yourself off, I think, from trial and error.
Yeah. I mean, I've learned now when I go to medical conferences and stuff, I just take my rooibos chai tea bags, because they never have anything like that they offer, at the break. And I take my little thing. I never leave the house without this. This is one of those little Contigo containers. They don't leak. I can throw it in my briefcase. I'll take it on the plane. And so in the morning, I make myself a nice rooibos chai, and I put in like a scoop of collagen protein. And you can't taste it. So now I've got like, 10, 12 grams of protein in the chai. And that's like kind of can sustain me through the day.
That's a great travel trip.
Yeah, little tricks you can do. And
because in the end, you just want like something delicious and that makes you feel good. I mean, that's why we want a chai or we want a pastry, because we're used to that making us feel good. But, you learn more, right? That makes you feel good over time.
Yeah. I like to go to, like, here in Santa Cruz, it's sort of the hotbed of everything organic. And, any of the health food stores here have, wheatgrass juice or, fresh juices. And even the little local market in my neighborhood has, every day they make like a beet with lemon and ginger.
Oh, nice.
And I just go and get one of those, and then I mix it with water so it's not so much sugar at once, with those, because they put apple juice in it. So I'll take that 1 8-ounce thing of fresh juice, and I'll mix like a quarter of it into a big thing of water, and then throughout the day I'll have a little more. So by the end of the day, I've drank a whole thing of fresh juice, but not all at once. So
I like that hack too. Yeah. I mean, that's kind of I don't always have, like the time to sit and eat like plates and plates of vegetables, but I can make, and I'll post this link to in the show notes. Like I can make a quick little light drink with lemon and greens. It isn't like, well, it's really heavy and hard to get down, but it's just giving me a little pick up. It's really nice.
So I've learned too, the other hack that I've been doing, because like it's busy for me running this company and traveling so much. So I'll take my Blend-Tech or Vitamixer or whatever, and I'll make up a big thing of smoothie with greens and collagen protein, and I'll use like goat milk whey sometimes, or things like that. Like I alternate the protein that's in there, and I'll put in a little bit of frozen low glycemic things like berries, like lots of blueberries and maybe a little bit of banana. But, I'm making like 32 ounces of this. And then I pour it into little 12-ounce bottles. And I have like, a few of those now. And then I'll have one after my workout, and I'll throw one in to take to the office. And when I get home, I might have one. So like, I'm keeping dosing the greens and the protein kind of throughout.
That's smart. That's a really
smart
idea.
If I don't get to eat a decent meal, at least, I'm staying, and it lasts 2 days. So it doesn't go bad in the fridge. So I've got enough for like that day and the next day.
Oh, so I like that.
I make a batch, and that's just always there. If I, because it stops me from going in and like putting the gluten-free toast in the toaster instead, right?
Yeah.
Because I can, it's like, I'm hungry. Oh, right.
Yeah, because the
I've got a
salad is time to prepare. So
Yeah,
if you have something ready.
I have to do things that are ready. So that's
I
my
like
trick.
it. We're just solving all the problems of the world
Yes.
today. I love it. Well, Rachel, super nice to meet you. We will share all these links, and I'm sure people have questions. They could come to you and your company as well.
Well, we don't really work directly with the end
Oh,
users as
gotcha.
much as just the physicians. So for or integrative people, or even like if you're seeing patients, basically, if you're a nutritionist or whatever, that's fine.
Okay.
Chiropractors, acupuncturists, whatever. So we have training programs for them so that they can help their patients. So if you're listening to this and you have an acupuncturist or chiropractor or an integrative doctor or a nutritionist that you work with, and they might not know about what we send them to us, train them so that they can work with you appropriately.
Okay.
And like I said, they can work with you guys, right? They can
They
call
can
you
work with
guys. Do you do
us.
Skype appointments and
Oh,
stuff?
yeah, we work with people all over the world. We have a lot of practitioners listening. So if you want to start an account with Biobotanical
Yeah,
Research,
you just go
let
to
them know.
just send in a request to info@biosidon.com, and that information on how to set up a professional account is on our website too.
Okay.
And we're distributed by Emerson and Natural Partners and Full Script and all of those guys.
Okay. Yeah, I think my account is like really bunk with you guys because I moved and I haven't updated it. So I have to go in there
I'll
and
fix you
try
up.
some
The good
things.
thing about having your email with us, yeah, even if you don't buy your products from us, like a lot of people like to order from the distributors because it's like a one-stop shop and
Easier,
it's more
yeah.
convenient. So that's fine. But make sure that we have your contact info because we have webinars all the time with really brilliant doctors. And so we don't spam people. We hardly send out any email. We send out maybe one thing a month or every other month. We're not the type that you're going to hear every week from us about something. No. So don't worry. Your email is safe with us. We don't share them. But that way, if something interesting happens, or like the liposomal formula came out and we did that big Lyme study on it, we had a webinar on that. So then, and then we keep those recordings on a special site for practitioners where they can access all of our old recordings of webinars on a variety of topics.
Oh,
Like Bill Carnahan did one on mold.
I haven't seen any of these. Maybe
Yeah,
I'm not on your list. It's a good thing we reconnected.
yeah. So we'll set up, and anybody who's listening, for health professionals, we have all that stuff. Unfortunately, the way the FTC or whatever and the FDA are in the United States, we can't really share the same information with the end users that we might like to because it's considered, medical.
Right.
And so
There has to be a go-between.
we have to rely on the practitioners to kind of get
That's
that out.
okay. I think that's okay because these are strong products and I think it's easy to misuse. So I just did another podcast and I talked to, if you go about a treatment and it doesn't go well at first, you'll give up. But if you have someone to guide you through it,
Yes.
that makes a big difference.
That does. Good.
Awesome.
Well, it's been fun, and we'll have to connect and make sure that you're all set up with everything and get you some toothpaste.
Yeah, let's do it.
Well, you have a great smile, so maybe you don't need the toothpaste, but
I think I do. I still need it.
all right. Well, it's been a pleasure being on, and look forward to hearing from all of your doctors here that are listening.
Sure, you'll hear with some folks. Yeah, thanks.